Arturo Loaiza-Bonilla. I'm a medical oncologist. I'm also the system-wide chief at St. Luke's University Health Network, which is a network of hospitals in the Pennsylvania region, mostly in the Lehigh Valley. So we're fully integrated IDN. I'm also the co-founder, chief medical AI officer of a company called Massive Bio that uses AI for clinical trials. So very happy to be here and the opportunity to talk about AI. Yes, AI is everywhere these days, right? So it's taken us by storm as a surprise because we have the ability to use artificial intelligence for many use cases. So just to define it first is artificial intelligence, we see it as computer systems or algorithms or models that are able to perform tasks that are cognitively usually associated with humans. So things that we usually took for granted ourselves to do all the time, now we have machines, computers to be able to do it. And that is encompassing many different topics. So it could be things like, for example, pattern recognition or visual perception. And that, for example, translates into pathology or radiology. We can talk about as well as translation. So translation of genomic data or any other data source into something that we can read in real time into our electronic medical records. Other things could be, for example, listening. So we call Ambient AI, where we're talking to the patients, or here, for example, and we get a full transcript of what we're just discussing today, and many other use cases. So right now, oncology is really ripe for transformation by using all these different tools. So I'm very excited to hear about what we can do to improve our practices together with this. Yeah, so the topics that we can discuss in AI oncology are so many, right? So it's mostly, I would love to hear what people want to, learn about, this technology is being applied. But a few things that come to mind right now is using it for clinical decision support, for example, using, for example, digital pathology to, solve the issue we have now with access to, distant, remote locations where they don't have enough access to biomarker testing or just even pathology itself. So using those tools with foundational models is something very relevant. We're also seeing an advent of using it for screening. So using AI-related tools for mammograms or for lung cancer screening, checking on nodules. And other opportunities that I see as well is how we can use it for data sourcing to solve difficult questions that sometimes we don't have the information right away, and we can use technology tools to do so. And lastly, I think that any application across the spectrum, for example, EKGs or using tools as well to do remote censoring. So for example, I had this ring in my hand. Can it help me to maybe guide my therapy better if I have I'm bispecific and now I'm going to have a fever or something that I really need to use right away to get an alert to my team. So AI has so many applications and we've been using it for many years, but now with the advent of generative AI, the sky's the limit. So very happy to see how the conversation evolves. So I think one of the first is asking a clinical question that is important, right? So there's a lot of things happening in the space, but what we want to know is not only the futuristic, but what we can apply right now. So it will be mostly focused on an expert or a team of experts that come and we can interview. We ask them clinical questions of what is the problem they're trying to solve with these tools? How can it help us to be better clinicians and be better in serving cancer patients and our practices as a whole? And then kind of set up the future of how these applications can be meaningful or optimized as time goes, right? Because even the same tools are going to have an impact in the future tools that are going to be developed. So I think that the structure would be, okay, what's the problem? What are you trying to solve? And what's the really applied tools for us? So to me, it's about practical applications of these AI technologies. And happy to hear what else the audience would love to learn about this. Well, the excitement comes from information gathering, from getting all these different stakeholders in a single place where we can have a conversation of the topics that really are really scattered around. So becoming an authority in terms of understanding the AI applications to me is key. I'm very excited to see that there's a convergence of different information points, and now they're coming to this series. It's a big opportunity to really expand it and make it aware not only in the United States but beyond. There's going to be an audience going to be interested to learn more. So that's what gets me excited about. Guess there's a lot of them that I feel could be relevant. As you can imagine, because I'm very passionate about the intersection of AI and technology, I see a lot of stakeholders that not really are on the screen. They're doing a lot of good work, but they're behind labs or doing things on their own, and they haven't had the chance to be talking about how these technologies can be applied. So I feel bringing not only academicians who are using AI as their own tools to be more efficient, but also technology platforms that are already deploying them at scale to help us to be better and more proactive. I would love to learn from folks who have implemented and understand the challenges and the things that are going to be practical for us to use these tools in large settings and also in the small settings, because as you know, oncology is so broad and 85% of the practices are not like big places. So they'll have different needs based on where they are. So to me, bringing some of those folks along with the solution solvers are the ones that I think it's going to be the best opportunity to have a conversation. So it can be up the way from Google that just talk about a multimodal pathology thing that is able to predict how things respond to certain drugs, to the practical use of Ambient AI on a scribe and make things easier for patients, or a voice agent that is able to get to patients in rural areas. So it has so many opportunities here that I feel excited about the multitude of folks who can come to this platform. One thing that I wanted to highlight is that there's so many tools right now that we can use. And some of the things that we'd love to talk about is how we're using Ambient AI, for example, in our practices, which is the most common use case of AI and in this time and age, but also how we can use certain platforms to predict when the patients may require certain treatments, or when we can use targeted therapies in a more efficient way. So there's a number of software applications that are using AI for that purpose and makes our life easier. And fast forward, then we can talk about bigger things like how this is applied for like drug discovery and finding personalized therapies. Just an example here, there's a lot of noise about these tech person who have no knowledge on oncology and whatnot, and their dog had mastocytosis of the skin, like a very interesting disease. And he used multiple, ChatGPT and Grok and mRNA technology to find a treatment for actually the dog. And now the dog is still alive and well and responding to treatment. So how can we translate that into really personalized therapies in the future? And I would love to talk about those tools as well, which are a little bit fast forward, but something that we're heading to. This is all about collaboration, right? I would love to hear what people are interested about. I would love to have the chance to, get updates that are in context to things that are happening in the space. So there's a new announcement or there's a conference that we are talking about. So we have ASCO, AACR, ESMO, ASH, all those meetings, they all have AI components, but they're not fully aligned in a single track. So what I would love to have is have that convergence of minds where we can bring some of those breakthroughs that are being shown in posters or in presentations, sometimes in isolation, and have them here. So I think that the opportunity is just so ripe for transformation that I'm very excited to see that.